7 recovery mistakes that ruin tummy tuck. I've seen patients undo thousands of dollars of surgical work with a single poor decision during recovery. The most devastating part? These mistakes are completely preventable. If you know what to avoid, like Jennifer, who lost her entire investment by returning to heavy lifting just 3 weeks post-surgery, thinking she was healed enough. One moment of poor judgment cost her a revision surgery and an additional $15,000. I'm Dr. Tim, and after performing over 1,000 tummy tucks, I've identified the 7 recovery mistakes that consistently lead to complications, poor results, and expensive revision surgeries. Mistake number 4 is so common that nearly 40% of my revision patients made this exact error. Coming up in this video, you'll learn the too much, too soon trap that destroys surgical repairs and how to avoid it, why following your friend's recovery advice could ruin your results, the hidden danger of perfect compliance and why some rule breaking actually helps, how emotional decisions in week 2 lead to physical complications in month 2, the long-term habits that protect your investment for decades. Stick around, knowing these mistakes could save you from becoming a revision statistic. The $15,000 mistake. Let me tell you about Jennifer's story because it perfectly illustrates how quickly things can go wrong. Jennifer had a beautiful tummy tuck result at 2 weeks. Her incisions were healing perfectly, her swelling was minimal, and she felt fantastic. So fantastic, in fact, that she decided to help her daughter move apartment at 3 weeks post-surgery. I felt fine, she told me later. I thought I could handle a few boxes. That few boxes turned into lifting a couch. The sudden strain tore her internal sutures, creating a massive seroma, and ultimately required a complete revision surgery. Jennifer's outcome went from excellent to disaster in a single afternoon, not because of surgical error, but because of one preventable mistake during recovery. Today, I'm sharing the 7 most common recovery mistakes so you can avoid Jennifer's fate and protect your investment. Mistake number 1, the too much, too soon trap. Let's start with the mistakes that ruins more tummy tuck results than any other. Doing too much, too soon. Here's what happens when you feel good at 2 to 3 weeks. Your pain is manageable and you think healed on the outside means healed on the inside. It doesn't. Your skin may look healed, but your internal tissues are still fragile. The deep sutures holding your muscle repair together don't reach full strength for 6 to 8 weeks. Common too soon mistakes. Lifting children over 7 kilograms before the 6-week mark. Even a toddler can stress your repair. Returning to gym workouts at 4 weeks just because you can doesn't mean you should. Heavy housework like vacuuming or lifting laundry baskets, these create internal pressure. Driving long distances before cleared, the seatbelt position and core engagement can be problematic. The solution? Follow the timeline, not your feelings. Your brain recovers faster than your tissues. Mistake number 2, following someone else's recovery. The second biggest mistake, taking advice from friends who had the same surgery. No 2 tummy tucks are identical. Your friend's mini tummy tuck recovery has nothing to do with your full abdominoplasty with muscle repair. Variables that make every recovery different, the type of procedure, mini versus full versus extended abdominoplasty, muscle repair extent. Some patients need minimal repair, others require extensive reconstruction. Individual healing factors, age, fitness level, medical history, smoking status, the surgical technique, drain versus drain-free, traditional versus advanced closure methods. What worked for your friend might be dangerous for you. Trust your surgeon's specific instructions for your procedure, not someone else's experience. Mistake number 3, the compliance paradox. Here's a mistake that surprises most patients, being too compliant. Some patients become so fearful of doing anything wrong that they barely move for weeks. This creates its own set of problems. Problems with over-compliance, blood clot risk, lack of movement increases risk, muscle atrophy, excessive rest weakens surrounding muscles, scar tissue buildup. Gentle movement helps prevent adhesions. Mental health issues, isolation and inactivity can trigger depression. The goal isn't complete immobility, it's intelligent activity. Move within your restrictions, don't exceed them, but don't be afraid of them either. Mistake number 4, ignoring your compression garment protocol. This is the mistake 40% of my revision patients made, getting careless with compression garment. I see two extremes, patients who never take it off and patients who abandon it too early. Both create problems. Compression garment mistakes. Wearing it 24/7 without breaks. The skin needs to breathe. Dependency can develop. Stopping use at 4 weeks. Most patients need 6 to 8 weeks of consistent use. Choosing the wrong size. Too tight restricts circulation. Too loose provides no benefit. Poor hygiene. Not washing it regularly can cause skin infections. The sweet spot, consistent use during the day, brief breaks for skin health, proper sizing, and excellent hygiene. Mistake number 5, emotional decision-making in week 2. Week 2 is when most patients hit an emotional wall. The initial excitement has worn off, you're tired of restrictions, and you start questioning your decision. This emotional low point leads to poor choice. Common week 2 emotional mistakes. Comparing your healing to social media. Those perfect 2-week photos are often filtered or exceptional cases. Panicking about normal swelling, expecting immediate final results, making major decisions about touch-ups. Your result isn't final for 6 to 12 months. Abandoning healthy habits, stopping proper nutrition or movement. Week 2 blues are normal. Expect them, plan for them, but don't let them drive your decisions. Mistake number 6, neglecting long-term scar care. Most patients focus intensely on the first 6 weeks, then completely abandon scar care. This is a critical mistake. Your scar continues maturing for 12 to 18 months. What you do during this time significantly impacts your final appearance. Long-term scar care mistakes, stopping scar treatments at 3 months, continue massage and topical treatments for at least a year, sun exposure without protection, UV light darkens scars permanently, ignoring scar massage, gentle daily massage improves final texture and color, not using proper products, silicone sheets, vitamin E, and prescription treatments all have their place. Your scar care routine should evolve, not disappear as you heal. Mistake number 7, failing to protect your investment long term. The final mistake happens months or years after surgery, not protecting your investment with lifestyle choices. Long-term protection mistakes, major weight fluctuations, gaining or losing more than 5 to 7 kilograms can compromise results. Smoking or vaping impairs circulation and accelerates skin aging. Neglecting core strength. Weak muscles put more stress on your skin. Pregnancy without planning. While possible, timing matters for optimal results. Your tummy tuck isn't a temporary fix. It's a foundation for long-term body confidence. Protect it accordingly. Now you know the 7 mistakes that can ruin your tummy tuck results. But prevention is only part of the equation. What happens if you already made some of these mistakes or if complications arise despite doing everything right? In my next video, I'll reveal the warning signs that mean you need immediate medical attention, how to tell the difference between normal healing and serious complications, and what to do if something goes wrong during your recovery. Click here to watch tummy tuck complications surgeons fear the most, because recognizing these warning signs could save your results and your health.